didn't know about Midwifery Business Consultation when I first opened, but I was so glad to learn about it. I think it was like late 2021 is when I met Leslie. And I remember our first meeting and I was just like so amazed. Like, can you just like come spend a week with me? And eventually, yeah, it was like so helpful. Over the course of a bunch of meetings, she got all my questions answered. It's just when you first starting out, there's just so limited resources as far as like there's nobody around to ask, there's nobody around you possibly doing this. There's not a lot that you can Google, so it's just it can be very intimidating for midwives, but it really has also been one of the most rewarding things I've ever done. And over the course of now almost 3 years, I've just grown. I've added a lactation consultant. I have a nurse practitioner starting in a few weeks. She'll be specializing in weight loss. So it's just all very exciting.
Oh, I'm so excited for you, Kristen. That's the cool part of this consulting stuff is we get to midwife the midwives. And I know you're going to tease that Kristen is joining our consulting team to add more services for Women's Health Clinic because Deidre and I have been getting quite busy and there's only so many hours in the day. And Kristen's in the thick of running a Women's Health Clinic. Yes, I do it a little bit on the sideline, but it's not a full scale business operation. So I'm really excited about what Kristen has to offer and expand. And it's just been exciting to watch you grow the last year. And these resources are so needed. And so, yeah, if you want to talk when you started your practice compared to now, what resources were out there and what would you have wished to have seen?
I honestly wish that I had known about specifically midwifery business consultation. There are other things out there, but I just didn't really feel like that it fit what I needed. And then also just like resources as far as like forms and consents and like all the things that you need starting up. And it's really just super important when you are starting out to make sure that you surround yourself with the experts in your community, which I did. I've been an accountant and an attorney, but the business consultant piece was definitely missing.
Yeah, you can get a small business consultant, but when you have to educate them what a midwife is and the day-to-day challenges and regulations, we're a specialty on top of specialty. And so, yeah, Kristen has been doing awesome with her service line. And sometimes we just brainstorm. I know eventually you just got to the month-to-month maintenance period where you'd have these amazing list of questions. And I just give you a different angle to look at it and think about it because I lived and breathed what you're doing and understand it. So I think at one point you were like, okay, I need to outsource to ultrasound. And I'm like, but she's down the hallway. Why do you need to get somebody on site? Just make a win-win situation with this person down your hallway. So sometimes just having some fresh eyes and angles was always helpful with brainstorming and someone that really gets what you're doing.
It's so incredibly helpful. Just to get somebody to help you think outside the box, think differently about something. Hey, have you thought about this? Have you thought about that? It really helps you give a new perspective for your business.
Yeah. Well, and especially a women's health clinic, I get conversations all the time where nurse midwives, nurse practitioners, they want to open a business, they want to open a practice, they don't want to be on call. That's the stigma. They're embarrassed. You and I talked about this and a personal story on the sidelines, that stigma. I can't announce I'm a midwife because I'm not catching babies right now. We have such psychology we put ourselves through because we're not fitting this box of what a midwife has to be to society. And so, I think that part of it is helping people through the business planning and what potential service lines and really utilizing everything within the scope of a midwife, because some people don't realize, I can do this, I can do this, I can do that. So Kristen, what services are you currently offering with your practice?
So I'm currently offering GYN services. So I do a lot of annual exams, pap smears, contraception, but I see women of all ages. So from adolescents to, I think my oldest patient she's like in her mid 80s. So It really, I find it so rewarding, really taking care of women across the lifespan.
Do you do a lot with the primary care or do you closely collaborate with an FP in the area?
So my patients have a primary care provider as well. I do tell them because primary care, there's such a shortage in my area. I do tell them, if you have something going on, just like let me know, and I can tell you if I can, see you for that or not. UTIs, there's stuff that's certainly
minor, colds versus an asthma attack. And that's part of making really good guidelines. Just because it's part of your scope, you are running the practice, you are running the business, you get to determine your service line versus you're employed somewhere. They just put it on your schedule and you just see them.